Hi, nursing besties. Greetings to all. Welcome to Queen Nazi's Diary. So, if you're a first time viewer, welcome. Subscribe, share, and follow for more. So, today I'll be talking about the 11 rights of self injection practice. As a nurse, you don't just give injection to the patient. Their rights before you give injection, you have to ensure that those rights are correct before you administer any injection to a patient. So the first right there is you have to ensure that the drug you are giving to that patient is actually the right patient you are giving the drug to. You can do that by going to the patient's bedside, checking the patient's chart, or going to the patient's bedside and ask, "Good morning, ma. Good evening, ma. Please, are you Mr. Jones? Are you Mrs. Jones?" Ensure that it's that patient that you are giving that injection. Don't just go and conclude on your own and give any injection. Then, the second right there is the right drug. Ensure that the drug you are giving to that patient, you are giving to Mr. Jones or Mrs. Jones, is actually the right drug. Assuming the patient is having malaria, you will give anti-malaria. Or if the patient is having pain, you give pain, you administer pain medication. Ensure that you are giving the right drug. Especially check the patient's folder. Check what is prescribed by the health physician for the patient. Don't just give. Then the third right there is the right dosage. Ensure you are giving the right dosage to the patient. Ensure is very important, because if you give overdose, it's actually a very big problem for the patient's health. So, or you give underdose is also very wrong. Give the actual dosage that is required. So you can also ensure that you are giving the right dosage by also checking the patient's folder, knowing the amount that is required for you to give to the patient. Then another right there is the right route. Ensure that the drug you are giving to the patient, you are giving it at the right route. If it is IV, you give it IV. If it is IM, you give it IM. If it is intradermal, you give it intradermal. If it is subcutaneous, you give it subcutaneous. Then if it is, as for example, immunization like BCG is actually given intradermal, that is in the skin. So you give it intradermal, you can't give it elsewhere. So always ensure, check the patient's folder, check the patient's charts. You can't just give. Then you also check for the right combination. So for the combination, you check for the right injection, like the right needle and syringe, which is in that combination. Then you also dilute it, how to dilute that particular medication you're about to give. For some injection, like you can give them IM, IV. For example, ceftriaxone, you can give it IM or IV. So for you to give it, check the particular one that is written in that patient's folder. It may be IM or it may be IV. Check it so that you will know how to dilute it. Ceftriaxone, you can use sterile water to dilute it. If it is IV, then use lidocaine to dilute it if it is IM. So before you give, check the right combination, check patient's folder, check patient's chart is very important. So another right there is the right time. Before you give any drug, ensure you are giving it at the right time. Like if that drug you are to give it at 2 p.m., ensure that you are giving it at 2 p.m. And if it is written there 6 p.m., ensure you are giving it at 6 p.m. Don't carry drug that is 6 p.m. and go and give it in the morning. It's actually very wrong. Ensure that you are giving that drug at the right time. Right there is the right storage. So if you are giving any drug, ensure that that drug is actually stored at the right place. For example, all these vaccines, some of them are kept in a very cold place. If you keep it in a hot place, hot temperature, it will damage that vaccine. So ensure that the vaccine or injection is actually stored at the right place. Then another right is right method of disposal. Ensure that the injection and needle you are using or you used is actually disposed right. Like you put it in a safety box. You don't just give injection with needle and discard it anyhow. Ensure you discard it very well. It's very important. Right there, which is the 10th right, is the right trained personnel. Is important because you don't just give drug or injection. Is actually given by the trained personnel, people who are actually trained for it. Then the last one in the 11 rights of self-injection practice is documentation. You see, documentation is very important in nursing. Like if you do anything and you did not document, it actually shows that you actually did not do anything. So once you do anything, just write it down, document it. If you actually check the patient's temperature at 1 p.m., document it. You now rechecked it at 2 p.m., document it. Like that documentation is, just know that documentation is very important in nursing. It's very, very important. Before you give any injection, check all this right. Ensure it's correct before you administer any injection to the patient. Thank you for watching my videos. Subscribe, share.